How you doing, soldier? You're not doing too well. Yeah. Abdominal wound. Look at that. Fucking ball did that. Buckshot and a 69 caliber ball. An abdominal wound. Not. So we're not gonna be able to talk to you at all. You understand what I said? You understand?
You understand? We're going to take you over and become a do you have some
No, I can do that. Just grab the 14 pounder. We're going to deaden the pain a little bit. That's all we can do. That's all I would plan to do. Keep that right where it is. All right, nice. You want help get him over there?
I got it.
Okay. He's going to Joshua Tree. You know what that means? Right.
It's like a gunshot wound of some kind, Doc.
Get him up on the table. Good job. Lay still. Yeah, lay still. I'm gonna feel around on this wound. Yeah, I know it kind of hurts, but take it easy. It won't hurt for long. He's lucky. Didn't hit bone. He won't have to lose his leg. You can walk with a limp for a while, but you'll be okay. We're going to do a general anesthetic here, so we need to have you lay on your back. There you go. How long you been in the Army, soldier?
6 months.
6 months. Well, you're going to be in longer because this is not a medical go to home thing. All right, let's do a general anesthetic. We're going to use ether. Now we're going to compress time. It usually took about 5 or 8 minutes.
Take a few deep breaths.
It took about 5 to 8 minutes
Deep
for it to
breaths.
take hold and then render him senseless.
Keep breathing. He has been rendered
Oh,
senseless.
thank you. Okay. Keep monitoring. Now, I'm going to extract the bullets now. So I will need bandage scissors. Come closer and watch if you like. You don't have to. But you're more interested in it. There it is. You know what? I'm going to have to probe for the bullet. You know what my best probe is?
Your finger.
My finger. Yeah, somebody's been watching before. Haven't they? We're going to probe with the finger, see if we can find that bullet. There's a couple things in there. Let's see. Yeah, the bullet extractor right there. Maybe I can do it. Got it. There it is. That's a 58 caliber ball. You know, it flattened out an awful lot, but it didn't hit his bone. I also felt something else in there too. So I'm going to look again. And he's not feeling anything, really. When she said he was rendered senseless. Really. So, I keep digging around here. Oh, there it is. It's a button. Really? Yeah. You know what? He is lucky. The guy that owned this button before isn't quite so lucky.
Sorry.
What? That's a button off of a jacket or a vest. And what that tells me is that bullet went through the abdomen more than likely. Mortal wound, like that guy. but it was almost spent and brought that button with him, and it hit him in the leg. He's going to be fine. All right. I would like, let's see if it's there. We're not going to sew it up. I'm going to put a morphine powder on it, and then we're going to have the nurse dress that wound again, and then we're going to send him back.
We're getting some eye flutter.
All right, I'm almost done here. All right. All right.
Do you want me
Dress
to
the
bring him
wound,
around?
put him on the hospital, and
Do you want me to bring him around?
you bet.
I'm going to ask you to just lay here while I put a fresh bandage on. You're going back to the hospital. We'll get you on the ambulance.
Are there any questions from what you just saw? It'd be pretty typical. Yeah.
What is your training?
What is my training? I had a year of study at the Rush School of Medicine in Chicago. And then I took another year, which basically taught me the same things again. I did learn a little anatomy. I have some friends who were good at finding fairly fresh cadavers, where I could learn anatomy. You know, working on a cadaver, it was thought of as, well, it was criminal. But
Can you help
you
me
have
with
to do something in order to
All
find
right,
out
we're
what
going to get
goes
you to the
on.
ambulance now if you'll swing your legs around.
Now, if I was in Europe or in England or even Canada, medical school was 4 years long. You could get licensed here in the United States in a year. You could do it that way through school, or you could basically intern with a trained physician. And after several years of helping him out, if he thought you were good, he would license you. That's the way it works here. Any other good question? Any other question? Come on.
Oh, come on. Anything. Throw us. Give us a question we don't have an answer to. We like that because we'll find the answer eventually.
Yeah, we're
What's
alive.
up? Come on. Nothing? Really?
What was usually used as a sanitizer?
Sanitizer?
Nothing.
Sanitizer?
What is that?
What's a sanitizer?
I have no idea.
All right. It's hard. It is very difficult to answer some questions and stay in the time. The idea of the germ theory, it was called, the concept that germs could make somebody sick, had been presented at a science forum in England. And Dr. Lister was laughed off the stage. They said nothing so small that you can't see it can possibly make you sick. The doc would stand there for up to 72 hours working, getting a shot of whiskey every hour, which, by the way, I want to be the first patient.
Number 11.
Because whiskey was thought to be a stimulant. The only reason he would wash his hands or his instruments is that, as you know, blood gets sticky. So after a while, everything is too sticky. He can't handle them anymore, then he'd wash them. You'll notice the blood on the front. It's not from him being splattered, although some of it could be. It's from him going like this.
Yep.
The idea of sterile surgery, sterile anything, just wasn't being followed right then.
Antiseptic surgery as well.
It took until the 1870s, and then their solution was to operate with a mist of carbolic acid being sprayed over the entire operating table. Not where I want to be. So
well,
that's why
clean.
no sanitizer, no sanitizing.
Not that stuff.
It's really kind of a scary thing. But the reason we let the gut shot die, anytime the body was opened, as he said, you run the risk of what they called inflammation, we call infection.
Sepsis.
And more of them died not from their surgeries. They survived the surgery. They didn't survive the infection that happened. Kind of interesting aside is that's where the female nurses came in. They were originally recruited for a lot of different reasons, one of which is they knew the importance of cleanliness. And because they knew the importance of cleanliness, They were expected to keep the soldier and his surrounding area clean. And that did help. In fact, the Confederacy was very quick to acknowledge that hospitals that had female nurses, that all the soldiers tended to get better faster. Sadly, it wasn't really accepted by the surgeons a whole lot. In fact, one was said to is quoted to have been said, "Well, at least with female nurses, the floors will be clean."
Now,
Any other questions?
somebody asked me much earlier. Yeah.
Was the practice of humors in that theory still really prevalent at this time?
Practice of what?
Humor?
Yeah, humors like phlegmatic, etc.
I'm not sure. I haven't come across it.
Malaria was because bad humor.
That air.
Bad air.
Yeah.
So yeah, there was still that theory.
The truth of the matter is, there are some things that I think today we look at and go, really?
I think that's what you're looking for.
Well, like how they would treat earlier doctors certainly if you were phlegmatic or if you were my brain is going completely blank, of course. Like if you eat like your blood thin leeches to rebalance.
Were they still? Yes. You want to really another
Yes, we
really
still used leeches, some of us.
sad note. So at the beginning of the war, the Surgeon General had his whatever doctors were there going to him and saying, "I think we need to update our medical manual." He goes, "I see no purpose in it." So the war started out with a manual based basically from the Revolutionary War. They were still bleeding.
They were still bleeding.
They were still
using
using leeches.
Cupping. They're starting to use
Kind of
cupping
fun.
again.
Cupping is back again. And so actually so are leeches and maggots now, but you have medical maggots and medical leeches now. But back then, yeah.
Medical maggots are used to basically clean away dead flesh. That's all they eat. Dead flesh. And it seems to work.
So if you have a compound fracture that is set, how are you going to keep that one clean? You put medical maggots in and they dead stuff, so it's all good.
No, leeches, yes, we still use leeches and bleeding. What am I trying to say?
Beats me.
Yeah, first goes the memory and I can't remember what was next.
It's sometimes very difficult. We have this, I've been doing this about a year longer than my husband has, and we trained with a group back in the Midwest, largest in the Midwest. But sometimes there's so much stuff running around in your head that your head works faster than your mouth, and then all of a sudden your mouth is trying to find the word and it's gone. So if you ask us questions, we can probably access that. Sometimes thinking about it. Yes.
Yeah. I've been told that in the beginning part of the Civil War, disease killed more people than anything else.
Through the entire war.
What about when weapons started getting rifled?
Still,
And the
believe it or
accuracy
not,
went up?
Still,
the problem is that because they didn't know about germs, because they didn't know that it could be spread through unhealthy things. In fact, prior to the war, the nurses in the military were men who were recuperating from something. Here's a pleasant thought. You have somebody with an open wound, and the person taking care of them is getting over measles. And he doesn't know to wash his hands. I'm reading a new book about nurses, written by the nurses that had worked during the Civil War. And one of the things that it mentioned was, because always they felt that in the beginning, especially after the war, and some of us who are older remember that it took a really long time for the Vietnam nurses to be recognized, even though they did amazing things. So what this person that wrote the book was saying, these women were put in such peril because if typhoid went through a camp or an area where they were, they're taking care of the person who's down and out with it. They don't know about germs. What's going to happen? So many of them did.
Louisa May Alcott got typhoid.
Yeah, she served as a
She
nurse for
survived.
five months and then had to go home because of typhoid. It's just an amazing number of women, and I'm sure docs too to some degree, but I think they had the alcohol that sort of helped them.
They were fickle.
Just saying. If you know of any nurses, especially female nurses, or if you know of any female doctors, the Civil War was a huge advancement for women in medicine. Prior to the war, it was considered unnatural for a woman to study medicine. The first certified female surgeon went to school and got into the school because the male student body decided on who was going to be the new class. They all thought it would be great to let her come in. Her name's Elizabeth Blackwell, because they wanted to see a woman fall flat on her face. She not only made it through, she, as I said, was the first certified female. Sadly, upon getting certified, she could not find a job in the United States, went to England, worked in I think it was a maternity. Anyway, she developed disease and she lost vision in one eye. Well, you can't really be a surgeon with no depth perception. But she did come back and serve during the war and actually started training nurses. Anything? Yes.
Who would license you to practice medicine?
The AMA was in force, but states would.
Okay.
Another one of those lovely stories.
Wait a minute.
Go ahead.
Correct. Are you talking about women in medicine or?